So the top-line results of TRIUMPH-4 are available, and this is a randomized controlled trial in overweight or obese patients matching retatrutide versus placebo in patients who also have osteoarthritis of the knee. Co-primary endpoint was weight reduction and reduction in knee pain. The results in terms of weight loss were amazing, a 28.7% weight reduction. We've not seen anything like this with injectable therapy. In terms of knee pain, there's a halving of knee pain when measured by the WOMAC score, and in post-hoc analysis, 14% of patients with a top dose of retatrutide were pain-free versus 4% with placebo. In terms of adverse effects, it's probably what you would expect in terms of GI side effects, similar to other high-dose incretin therapies. But what was sort of new was some skin dysesthesia, which I'm sure Amar will cover. So that's the what.
So what, Patrick? Well, I guess the first thing we'd say is that we need that paper, don't we? We need to know a bit more so we can scrutinize exactly what this means. And of course, we need this molecule more readily available. But from what you mentioned, really, and what the top-line data suggests, that 30% almost rate reduction is certainly significant and in keeping with what we know about retatrutide being such an efficacious molecule. Is it that weight loss that's causing the benefit with less pressure on the joints and less load? Or is it the other effects that it may have, including improvement in cardiovascular risk factors, lipid lowering, systolic blood pressure reduction, and that hsCRP reduction, which we think that inflammation is related to a lot of the reasons why these incretin molecules have their beneficial effects. The discontinuation rates are something to be aware of, mostly GI disturbances, but also this mention of dysesthesia, altered sensation, which we're seeing more and more with the higher strength and more efficacious molecules. Whilst it didn't lead to discontinuation, what are the reasons for this? Is it micronutrient imbalances or electrolyte imbalances? More data that's coming over in the forthcoming year will probably give us more insight into this. What we do know is this is a very patient-centric outcome. Patient WOMAC scores improved, suggesting that actually this molecule is effective in what it does in terms of arthritis and improving those symptoms. And we're moving more and more into an area of multiple long-term conditions and managing weight plus other conditions. And also flipping it, in people with arthritis, it highlights the importance of weight reduction as well, potentially a triumph for this trial.